Hello and Assalamu alaikum. Ultrascan diagnostics. This is the high resolution endo mode for the patient. The area of interest is the upper left first molar. On the radiolucency, we can see that there is furcation involvement on the 3D rendering. There seems to be a little bit of a periapical radiolucency or pathology associated with the cortical plate on the distrobuccal root of the upper left first molar. Looking at the transaxial view. This is the transaxial view of the patient. Here we go. On the transaxial view, we can clearly see that this patient has had a root canal treatment done. Root canal treatment done on the mesiobuccal root is clearly visible here. This is the root canal treatment done. It is short of the apex. We can also see that there is a crack present associated with the mesiobuccal root. The crack is extending all the way into the interradicular area, and associated J-shaped radiolucency is also present. There does seem to be signs of a crack which extends from the coronal part, which is right on top of the crown. This extends all the way down, and this is associated with the interradicular area on the upper left first molar. Moving to the palatal aspect, we can clearly see that the radiolucency is quite extensive. The palatal canal is not obturated fully, and we can see there is a radiolucency which is communicating with the maxillary sinus. There we go, and we can see a little bit of a sinus mucosal thickening as well. The distrobuccal canal, we can clearly see this is the distrobuccal root. It is also not fully obturated. Approximately the obturation is short by 5.7 millimeters, and we can see that there is a significant PDL widening and involvement of the furcation area, which can be associated with the crack. Looking at the tooth from an axial point of view, we can see that this tooth has a large radio-opaque filling, does not have a crown restoration. This is the crack which can be seen, that this is a vertical root fracture of the mesiobuccal canal. The vertical root fracture can be clearly seen extending from the mesial aspect to the interradicular aspect, and this is the crack highlighted right there. As we move apically, the crack extends, and the radiolucency is also associated with this tooth. So if you have any further questions regarding this case, please feel free to reach to our team. We would be glad to help. Thank you very much.